our work does matter. What we did this year, I'm just going to give you a real high overview of the study I'm about to explain. Earlier in the year, we did a study with Nielsen. It was one of our market studies in which we pulled together and looked at about 700 people who were our constituents and about 700 people who had arthritis but had not interacted with us. There was also 140 parents of kids with arthritis that we looked at. We've kept the parents' content separate because we have to look at that differently. It's a very different audience and we have to analyze it differently. Most of what I'm going to show you is going to be the more general, the adult comparisons. Our constituents have a higher level of pain and a higher disease severity starting out of the gate. So on that, I showed you earlier the pain scale, 4.5. The general public, people with arthritis, who said a doctor had diagnosed them, their average pain was 4, so a little bit lower. The average disease severity, it comes from the Rapid 3. I won't explain it here, but you can see that the numbers are higher for the Arthritis Foundation constituents, so they have a higher disease severity by a few points than the general public. This is one of my favorite slides. It's just a simple question. The question was, true or false? I agree or don't agree. There is something a person with arthritis can do to make their arthritis better. It's a pretty statistically different rise in the Arthritis Foundation population. 86%, yeah, I can do something. I'm glad at least 70% of the general public thinks so, but it's a big difference in that mix. On the more medical side, improving outcomes, AF constituents are more likely to have sought treatment from a doctor or tried a new medication, significantly more likely to have sought treatment from a doctor. This is interesting to me. This is the kind of doctor they've gone to. So both groups have seen a primary care physician at some point for their arthritis. That's where we often start. If you have OA and other conditions, it may be where you stay. But the difference in seeing a specialist, a rheumatologist, or a physical therapist is 3 times higher among those who have interacted with the foundation. How did it make you feel? What did you do as a result of getting it? So to that question, 64% say reading Arthritis Today makes them feel more confident. 60% of people that got the Better Living Toolkit say they use it. They're using the health tracker. They're actually using it to track their health and improve their communication with their doctor. 76% of people who come to the Advocacy Summit every year say they have a higher level than going back and advocating for their own health care. And 72% of the JA families said their child learned something new at camp, but about 100% would recommend camp to another parent. All right, so I think we've got a video here that will tell you some of that story in patients' own words.
Every time I'm faced with a new challenge, I immediately go to the Arthritis Foundation tools, whether it be on the website or I call. For me, it is just a vast resource for being able to live my best life. And that's why I'm so attached to and thankful for the Arthritis Foundation and everything they've done for me.
There's so many kids who go through what I go through, and I'm not alone in this fight. It's a great feeling to know you're really not alone in this. Because a lot of the times that's what it feels like.
It's really hard to see your child in pain in it, and we're so motivated about the Arthritis Foundation because they are working hard to find better therapies, to find that elusive cure so that we won't have to see our kids in pain.
The Arthritis Foundation has let me find my voice. It has brought out a whole other part of myself that I never knew existed. I found that I'm not only advocating for myself, but I'm advocating for others. It's become a big part of my life, and I wouldn't change it for a minute.
That takes me to my last "what does it mean for us" slide. We know something. We know what matters. We know a bit about how the work we're doing is having an impact. We've got to do a deeper analysis. It's really incumbent on us to understand what it is we're doing that's having what impact and where we maybe are missing the boat still. So what needs are still unmet? Well, we looked at that depression and hopelessness thing, right? That's a big unmet need. There are others, and we've got to do more work to make sure we're listening the right way, and thinking about what we're doing to look at the unmet needs. And then we've got to commit ourselves to analyzing which of our current programs, activities, tools, and resources are having positive impacts. So we'll know where to invest, where to put more effort, more energy, more of our time and effort.